Hi friends. Welcome to our channel Global Health Helpline. Today we will learn about a homeopathic medicine Argentum Metallicum from the book, Lectures on Homeopathic Meteria Medica by James Tyler Kent. It is the second part of this video. Please see first part by clicking on the link given in the description box. Please subscribe our channel to be connected with us. Abdomen. Argentum Met has abdominal troubles. Bruised, sore feelings in the abdomen. If these progress from a catarrhal inflammation of the mucous membranes to a general congestion of all the tissues in the abdomen, diarrhea comes on, or constipation of the most inveterate character, tuberculosis. Of the mesenteric glands, emaciation, weakness, trembling. Paralytic feelings here and there in the body. Painful soreness, in the whole abdomen in connection with the urinary troubles. It has a low form of tissue making, such as tuberculosis, cancerous affections, infiltration, such as we have me. Ancient. Dry stool, like sand. Undigested stool, very offensive. Catarrhal inflammation of the mucous membranes of the urinary passages, the whole urinary tract. It cures albuminuria, it cures diabetes, with sugar in the urine. And many of the broken down conditions of the kidneys. Low, broken down constitutions. Enormous quantities of whey like urine. A copious flow of urine. Children lose the urine in sleep. Broken down, nervous constitutions lose the urine in sleep. Genitals. It has a very decided action upon the genitalia of both male and female. In the male it especially affects the testes and the mucous tract. It infiltrates the testes, producing hardness. In the text it reads, crushed pain the right testicle. Clothing increases pain on walking. Inflammation with infiltration. Chronic orchitis. It has cured a very suspicious testicle believed to be a cancerous affection, which began in the epididymis, following a gonorrhea. Inflammation, great hardness, pain, swelling, burning and stinging. Another symptom here is of great importance. Yellowish-greenish gonorrhea of an indolent character from the beginning, of 8 months standing. That clinical symptom has been verified. Now, it is a natural feature of gonorrhea for the discharge to be yellow, or yellowish-green, and thick in the early stage, for it then to become lighter and lighter until it is whitish-thick or thin, growing lighter in character until it becomes white in. Gliti. Argentum Met is the remedy when the discharge remains yellow. The pain has all ceased, and generally when the pain ceases the discharge soon begins to be lighter, but in the Argentum Met cases pain ceases, it becomes a passive discharge, the urethra loses its sensitiveness to pain, and th. Mucous membrane loses its sensation to a great extent, but the thick greenish or yellowish discharge remains. Now, in these thick passive discharges that are long-standing, old cases, we are very much troubled to find remedies. These old stubborn cases that still remain yellow, and still remain thick. They will not yield to ordinary remedies, they come under a peculiar class of remedies. Argentum Met, alumina, alumin, sulfur. Ones not usually thought of in the early period, but the general constitutional state of the patient forms the character of his symptoms. In the female we have ovarian troubles, infiltration, hardness, cystic troubles, cystic ovaries, that are cured by this remedy. Ovarian tumors, very large, hard indurated ovaries, especially the left. The right testicle, the left ovary. Pain in the left ovary and back. Prolapses, with pain in left ovary. Pain in the small of the back while sitting. The cures have been predominantly of the left ovary, although it cures complaints of both. Another grand feature found in this remedy is weakness, relaxation of muscles through the whole body, trembling. And now, if that thought is applied, if that feature of the remedy is observed in the pelvic organs, it will be seen that those muscles that hold up the uterus, the broad ligament, etc., are in a state of relaxation, they allow the uterus to sag. In other words, we get prolapsis. Prolapsis. You will be astonished to know that homeopathic remedies are wonderful in their ability to create tonicity, and thereby restore the prolapsed uterus to its normal position, and to remove the dragging down feeling women generally describe, a sensation. As if the inner parts were being forced out. All of these are sensations that accompany a prolapsus. Argentum is one of the medicines. In fact, the whole pelvic system is engorged, increased in weight, tissues infiltrated, likely to be hardened. Cervix congested and indurated. Takes on ulceration. Greatly enlarged, congested. It has been a palliative medicine in epithelioma of the cervix, with burning, stinging pains, copious, putrid, yellowish-green and bloody discharge. It has cured a tendency to menorrhagia, copious menstrual flow. The relaxation that must be present in hemorrhages will soon be overcome when the symptoms agree, when the general state is present. Ulcer of the uterus. Discharge purulent, ichorous. Sometimes bloody water, with unbearable stench. It is a medicine increased in weight, tissues infiltrated likely to be hardened. Cervix. Neck of the uterus very much swollen, presented a spongy mass deeply corroded with ulcers in different directions. Quote, where it was given in case of Chlorosis of the uterus it says, in less than 3 days foul smell was lost entirely. When a remedy acts in that manner it actually stops the growth. In fact, a cancerous state that would go on to its termination in 14 to 16 months will go 2 or 3 years and the patient remain comfortable. The remedy that is indicated stops the ulceration, it checks the destruction, and keeps the patient comfortable and with her friends for years. In cancerous affections the state of life is very low. The state of order is generally beyond restoration. Voice and larynx. Then we come to a state of the larynx. It is a wonderful laryngeal medicine. Loss of voice with inflammation, from overuse of the voice such as occurs in singers and talkers. One who is compelled to use the larynx much. It is then a paralytic weakness of the vocal cords. Running all through this remedy there is aggravation from any little prolonged exertion, a paralytic tendency with aggravation from exertion. So it is in the lungs, in every part of the body. And then comes the loss of voice. Now, apply all that we know of its ability to infiltrate. We have tuberculosis of the larynx. Singers, public speakers, who are broken down, nervous, of poor digestion, bad inheritance, take on tuberculosis of the larynx, and the voice is lost. Ulceration follows, and this trouble finally goes into the lungs. They emaciate and get night sweats. Loss of voice, generally of a painful character. Again, colds settle in the larynx. Cannot speak a loud word, constant tickling in the larynx, provoking cough. Rawness and soreness in upper part of larynx. Laughing aggravates the coughing. Laughing will cause tickling in the larynx, and he will scrape out quantities of gray mucus. If the irritation is in the smaller air passages, in the lungs, laughter will set him to coughing, and he will scrape out gray mucus. Over the bifurcation of trachea, a raw spot, when using the voice, talking, laughing, or singing. Quote, in the middle of the chest a raw sensation. Roughness and hoarseness of the voice. Phthisis of the larynx. In those withered young people, a young man when he is not more than 25 looks to be 50. Many wrinkles as though he had had many cares. Has a dry cough, gets up a little gray mucus. Yet he may be somewhat wiry, getting about fairly well. Has inherited phthisis. The cough is a deep cough, is aggravated from laughing, talking and in a warm room. Laughing causes cough and causes mucus in the larynx. This remedy will turn aside this threatening phthisis, this dry teasing cough. A little dry, hacking cough especially comes under this remedy. In no instance are we likely to have those violent spasmodic shaking coughs, such as we find in Bryony. A. When coughing a sore feeling in the larynx. The cough is accompanied with an easy expectoration. He does not usually cough so much to get up the mucus as he does to relieve a little irritation. But when there is mucus it generally comes up easily. It is not so difficult to detach as we find in many remedies. Easily detached mucus in the larynx. He simply scrapes it out by an effort of the larynx. Cough and scraping of the larynx during the daytime and evening, worse in a warm room and better in the open air and from motion. It has a sense of weakness of the chest. There are 2 remedies having this weakness of the chest and you cannot easily tell them apart. Weak voice, weak chest, a feeling that it is so difficult to breathe, and so difficult to talk, and so difficult to cough because the muscles of the chest feel so weak. These 2 medicines are Argentum met. And stannum. Great weakness of the muscles of the chest. The patient dwells upon it much, and it is a weakness far beyond what can be accounted for in tuberculosis, a sense of muscular weakness in the chest. A paralytic weakness of the chest. Of course, this is wholly different from the antimonium tart, which has a dreadful weakness of the chest, but in that remedy you will remember it is in the acute affections. It is suitable in lingering complaints, sickness of long standing, so that great weakness of the chest means that which I have tried to describe and it is that which patients will often fail in their efforts to describe. Doctor, I feel so weak in the chest. Now, this remedy is full of cardiac disturbances. Palpitation when lying on the back. A sense of trembling in the chest. A sense of quivering, fluttering, or trembling, as it will be described by the different patients, trembling in the chest. That tremulous weakness of the whole body, bands and feet, palpitation with general trembling is strong in this remedy. Frequent palpitation. During pregnancy, palpitation. Palpitation at night. Palpitation associated with headaches. Quote, with general weakness. Gradually increasing weakness. From his general weakness, the knees knock together when walking. Trembling in the knees with palpitation and general weakness. The limbs become stiff. Numbness in the limbs, as if asleep. Loss of power. Many of the complaints are increased during rest. Pain in the back and limbs while sitting, better while walking. All the nervous excitement that is possible.